And I'd like to, again, thank the Focused Ultrasound Foundation to be able to present my work here today. There's a few of them. I'd like to talk to you today about vascular permeability changes following copper doxorubicin release from temperature-sensitive liposomes. In some of our previous work, we found that twice-weekly treatment with doxorubicin in temperature-sensitive liposomes in combination with hyperthermia results in complete regression of local disease. What we did find with our strategy, which involves preheating the tumor for 5 minutes, is a gross hemorrhage on tumor histology immediately after the DOX TSL plus ultrasound treatment. So this led us to wonder, can this vascular damage be used to gauge treatment success? And can we use something like DCE MRI to measure these vascular changes? So we hypothesized the treatment with DOX TSLs plus ultrasound caused changes to the tumor vasculature that could be immediately detected with DCE MRI. So to measure changes in vascular permeability following treatment, we basically took our treatment protocol and just added the DCE MRI sequence to the end of it. Our animal model, as I mentioned probably earlier, is FVB mice implanted with NDL tumor line, and those are syngeneic orthotopic, and it's a mouse model of breast cancer. The doxorubicin was encapsulated in temperature-sensitive liposomes and injected intravenously. The protocol of the temperature, or the heating rather, is maybe a little bit different than you may be used to, but we typically preheat the tumor at 42 degrees C, at which point we inject the doxorubicin liposomes and continue heating for another 20 minutes. Then the animals are taken off for MRI. So the DCE MRI kinetics data that we found an obvious change in the tracer versus time curves in animals treated with DOX TSLs plus ultrasound compared to untreated tumors. And the result was consistently observed in these tumors. Likewise, untreated tumors were pretty similar and consistent across their cohort. Here's an overlay of the two, the dashed lines being tumors treated with DOX TSLs plus ultrasound, and the solid lines, the controls. So the DCE MRI kinetics data can be initially analyzed using what's called a step-slope method proposed by Curry et al. In this first analysis, we look at the step, that is the initial jump in the tracer concentration following bolus injection of the tracer. And this is related to the tumor's effective vascular volume as the tumor's vasculature is filled by the tracer in the first pass. So here we can see that the treated tumors have about half the effective vascular volume of the untreated controls. But next we have to look at the slope of the curve. So for the untreated tumors, we see a negative slope, while the slope is positive for treated tumors. This suggests a longer lasting blood-to-tissue exchange in treated tumors. Using the same data as an input for a two-compartment pharmacokinetic model, one compartment in the model being the blood plasma, or CP, and the second compartment in the model C1, in this case the tumor tissue, we can derive constants K1 and K2, which are related to the movement or the rate of movement of the tracer between the blood plasma and the tumor. And what's called the volume transfer coefficient, which is essentially the ratio of the rate of tracer moving into the tumor to the rate of tracer moving out of the tumor. And what we find when analyzed in this way is that the volume transfer coefficient increased by 50% in tumors treated with DOX TSLs plus ultrasound. So this basically tells us that there's a net accumulation of the tracer in the tumor following this treatment. So in conclusion, we found treatment with DOX TSLs plus ultrasound resulted in a change in tumor vascular permeability that was detectable and quantifiable on DCE MRI using a two-compartment model. And we found that the alteration of the tumor vasculature, we found an overall increase in the volume transfer coefficient and therefore an overall increase in the transfer and accumulation of tracer and hopefully also drug. And this can be used possibly as a way in the future to provide feedback as to the efficacy of these types of treatments. I'd like to thank Professor Kathy Farah, my lab mates, and funding sources, and thank you again for your patience.